Northwell Health has a tradition of training residents and fellows throughout its hospitals. Currently, there are close to 1,800 trainees throughout the health system. Southside Hospital is now part of that proud tradition, welcoming our own residents in obstetrics and gynecology and emergency medicine in recent years.
The emergency department sees about 78,000 visits a year, which in terms of emergency departments is certainly far from small. The hospital itself is about a 350-bed hospital, and we are the receiving center for Northwell's Eastern region. So we accept patients from other hospitals for trauma cases, neurosurgical cases, complicated cardiac cases. Those are all things that come to our doors, and it just makes for a much more robust learning environment for the residents.
So there's different ways you can do that.
So you have epiglottis? You have epiglottis, you got posterior folds, right? So that's perfect. So you know that if you can get your bougie in between those two things, you're going to be in. The simulation equipment that you see behind us is one thing that we kind of utilize to train our residents on procedures. So we've got a station for some pediatric procedures where they can intubate pediatric patients, spinal taps on neonates, which we often see here. I've got some of my second-year residents behind me kind of instructing some of our junior residents on intubating adult mannequins, proper techniques.
Needle, wire,
What's nice about being such a small program and a new program is that I am as much in the trenches with these guys and my faculty as anybody could be. We're actually as small as you can be to be a residency, so we're 6 residents per year in a 3-year program, and have a lot of faculty at the same time who have combined decades of experience in teaching residents.
Coming to a new program, I didn't know what to expect. I wasn't sure who were the staff, what was the training going to be like, but everything has worked out exceptionally so far. I see a lot more pathology than I thought I would, and I get to do a lot more than I thought I would. As well, everyone has been super helpful in terms of guiding me, and it's been so far a tremendous experience.
Our residents get a lot of individual attention. Specifically, if I were to speak about ultrasound and bigger programs, you have multiple people scanning together. You have your medical students, might have your third, your second, your first year, and then a couple of med students. You walk in with a group of 5-6 people who's really learning. Whereas here, they're scanned individually with me. So anyone who's on their rotation, they get one-on-one teaching from their ultrasound director.
Northwell has resources to help educate residents that most healthcare systems do not. With a state-of-the-art simulation lab that residents visit regularly and an ultra-modern cadaver lab where residents practice procedures on actual human tissue, there's endless opportunity to sharpen their skills. We are a community-based university hospital. Our residents train in a busy tertiary care center and collaborate with our world-class specialists while also serving the most vulnerable patients from within our surrounding communities.
It gives the resident more complex patients to see. So instead of seeing maybe just more bread and butter emergency medicine, which we get our fair share of here, you get to see the sicker patient, the more difficult to manage patient. And the more of those you see as a resident being supervised by other attendings, the better equipped you are once you graduate.
Most recently, at the height of the COVID-19 pandemic, Northwell and Southside constructed a field tent in a matter of days and became one of Long Island's most trusted battlefronts to combat the disease. Our residents played an integral role in caring for these patients and delivered superb care under incredibly trying circumstances.
I would have to say I've probably seen the craziest things in this hospital, and I worked in a lot of places. Trained in the city. So I came in with a city mindset. Long Island was very different. The diversity of cases that we see here is definitely great for the residents and for the attendings. Just because we don't lose our skills, we get to learn every day, and we have great cases every day.
Complex cases in a busy tertiary care center with small class size provides a unique learning environment for our residents not found anywhere else.
Having a class size of 6 people, I love that because first of all, you get so much time with your attending doctors, and you get limitless opportunities to do procedures, to train, education. It's so much more focused, and the structure is just so much more open to maybe our influence or our suggestions being a new program. I think that I also like that. And then, I mean, who doesn't want to live in a city called BayShore?
The Bayshore community really offers something for everyone. Whether you're single or have a family, whether you like to relax by the water or jog for miles, anyone can make themselves at home here with safe neighborhoods and good schools. Downtown Bayshore is that classic Americana Main Street with unique bars and restaurants, boutiques, and wine shops. You're never too far from an endless list of sporting and entertainment, recreation, and shopping. And nearby, we have some of the most iconic beaches, spanning Fire Island to Montauk.
I'm not from Long Island. I have no idea about any of these cities or towns before I came here, but it's actually quite nice. There's a couple of main streets with like bars and restaurants and stuff, and that's been really nice to go out to. We're also 10 minutes from a couple of really nice beaches. Robert Moses is the major one, and it's gorgeous, especially in the summertime. I think we are so close to the city that anytime I want to go to the city, I go there. I go there probably twice a month. The train is direct. It's really not that big a deal. So it's pretty convenient for all the things I need to do.
At Southside Hospital's Emergency Medicine Residency Program, we aim not only to deliver exceptional care to our patients, but also to train the next generation of emergency physicians to carry on that mission.
Northwell has a big reach as an umbrella. They have facilities spanning from Westchester through Manhattan, Brooklyn, Queens, and all across Long Island. When you come out of here, if you're looking for a job, and a health system to stay within for a career, I mean, there's plenty of opportunity here.
To learn more about us, visit northwell.edu or our residency-sponsored homepage at BayShoreEM.com.